certainly an ambitious service delivery plan. There are a lot of things that you need to achieve during this year. There's already stresses on the health department in particular, well, health and social care, but certainly on the health service. Is this achievable within A, current budgets, and B, current staffing levels?
I believe it is. I mean, I think it is ambitious. It's massively ambitious what's in there, but I don't think it's unrealistic ambitious. I think it is realistic, and in fact, if we achieve what we've set out in the service delivery plan, a lot of that alleviates the pressures around the department rather than adding to it. I think the problem is in government sometimes there's this tendency to play things safe, to only maybe stretch yourself to do what you need to do to plod along. And I think we need to do more than that in the Department of Health and Social Care. When I say I want a transformative system, where I want to transform the system and have something that's bespoke to the Isle of Man, make it a great place for people to work and a great place for people to be treated, I mean it. I actually mean that's what I want to end up with by the time, or at least be heading in that direction by the time my time as minister, whenever that may be, is up.
Now, how much of this work is going to be administrative and how much of it is actually clinical?
I think it's a mixture of the two, really. Obviously, there's going to be administrative things in the background as to how we transform things, how we work better together. There's IT projects in there as well that you might say are administrative in many ways, but it's about transforming the system, and it's about engaging with the people on the ground as well. A lot of what is in the service delivery plan has come from ideas from people on the ground. In the Department of Health and Social Care, we are very, very lucky across the board to actually have very dedicated staff who are always putting the patients and service users at the heart of what they do. And I think one of the key things not to forget is when you talk about pressures in the health system, it is the Department of Health and Social Care. And I don't want social care to be seen as the poor relation. That's equally as important. We've got the mental health division in there. We've got the children and families division. There's public health as well that is going to be massively important in driving forward the community aspect of our healthcare. But I think the service delivery plan is a great vision of what we need to do over the next year. It's very clearly laid out. It's in proper English everyone can understand as well. And I think, hopefully you'll agree, having read through it, that the milestones and how we are measuring is easily understandable as well on each of the topics, so that anyone, any member of the public, because it is a public document, can go and look at that and then see how the department is performing.
And how are you going to keep tabs on its progress?
It will be monitored, obviously, at a management level through the leadership team within the department. It will also be monitored at council and ministers level in terms of how it's delivering for the programme for government. It'll be monitored by myself at a ministerial level, and also the department board meeting, which consists of myself, the other political members and the senior leadership team, will also be monitoring it on a monthly basis. And obviously the divisions themselves will be monitoring their individual targets on the ground. So in terms of monitoring, I think it's safe to say there's a lot of it. We set ourselves some very ambitious timescales. I do think they're realistic timescales, but you never know what's going to come out of left field. But the key thing is, if there is slippage, it's important that we keep working towards it. Just because there's a bit of slippage, it doesn't mean you stop doing something. It just means the timescales have to change maybe by a couple of months or so until it's going to be delivered. But again, I think the key point is that if there is any slippage on something, it's public. It's easy to see, and via the monitoring within the department as well, it'll be very clear to me as minister if there's any slippage, so I can start querying and questioning why the slippage has occurred. And it's also at a board level, so my other political members also have input, and the senior divisional team as well, the leadership team within the department can, and ultimately for the programme for government, council and ministers can, and the public will see that as well. So if there's slippage, there needs to be justification as to why there's slippage. I think I've said here before that when it comes to key performance indicators and milestones, if everything's red, then you worry. If everything's green, you get suspicious, because we live in the real world and nothing is ever always going to be delivered on time 100% correctly. It would be a wonderful world if that was the case, but it's not. And I think what we have to do is be realistic about it and say, these are our goals, this is how we're going to try and get there, and that we keep working until we do get there.